why do some procedures not get paid at the full fund rate? Well, it's a so that's a good question. When you talk about procedures, I presume we're talking about sort of surgical operation type items. There is a rule in the MBS which says that items in category 3, group A, which is all the surgical procedures, if you perform them all at the same time, there is a multiple operation rule that applies to those items. So what that means is really this is something that's been designed for surgeons. So if you're doing an operation, say on somebody's bowel, and at the same time you perform taking out their appendix as well, those are two separate items. But because you're doing them all together, obviously the surgery is going to be more simple than having to do those things separately. So that's the concept behind why this exists. And in practice, what that means is the first item gets the highest paying item gets paid at full price. The second item gets a 50% discount and then a 75% discount. And how that applies to ICU items is some of the items that we claim or bill in intensive care fall under that group. So unless you specify that those items have been done separately and use appropriate overrides when you put in your claims, they will be subject to those rules. So if you know what you should be getting for the item and you're getting less for it, then that's the most likely scenario. I mean, there are potential other other things in the background. Sometimes the fund uses different schedules, or the patient's on an old insurance type, which uses a different schedule. So sometimes you can get discrepancies. But if it's particularly relating to procedures, then that's the most common reason why you wouldn't get a full payment.